Welcome, friends. It's Dr. Jen here with you from Rightway Health and Wellness. Now, today we're going to talk about the importance and the benefits of vitamin C. I'm going to share with you a presentation that I put together very quickly and that I think you will appreciate. And then you can also refer back to that if needed. All right, so let's look at the health benefits of vitamin C. There's many, and we're going to just talk about a few because these are the few that I see quite often in my practice at Rightway Health and Wellness, where I help patients to rebuild their immune system after dealing with chronic disease or during the process of dealing with chronic disease. So we're going to talk about where vitamin C played a role early in medical history through the prevention and treatment of scurvy. We're going to talk about its role vitamin C has with just the common cold and any types of viruses such as the COVID-19 or other types of viruses. The role it plays with lead, toxicity, the anti-cancer potential, how it aids in boosting the immune system, lowering hypertension, reversing cataracts, combating strokes, and maintaining the elasticity of the skin and healing wounds, especially with diabetics. So the important sources of vitamin C, it's ideally you want to get it in your diet. Okay, you want to eat enough fruits and vegetables that you get an adequate amount of vitamin C. Do I see that? No. In the 20 plus years that I have been working in integrative medicine, most of my clients, which would be more than 95%, will have a deficiency of vitamin C. So it's a huge problem. And it's the degree of deficiency that leads to the disease process. So you should, if you have no diagnosed disease process, you should be eating 8 to 10 servings of fruits and vegetables a day, and that will help to prevent it. If you already have been diagnosed with a chronic disease process, you may need up to 15 servings of fruits and vegetables to give the body the critical nutrients it needs to reverse the disease process. So, symptoms of scurvy are symptoms that we see a lot of these days, right? Like fatigue, bleeding gums. I have lots of clients who struggle with periodontal disease. We see a lot of anemia and then high fevers and people not able to explain why they're developing these fevers. So are we seeing signs of scurvy? Could be, definitely could be. We are definitely seeing signs of vitamin C deficiency because our body doesn't make it. We have to ingest it in order to get it in. Treatments of the common cold. So vitamin C has been very effective in helping to prevent and also helping to treat the common cold during the midst of it. And so there's studies that have shown that when you administer vitamin C regularly and you have exposures to the cold and you contract it, that it will reduce the symptoms for you in the amount of time that hangs around. It also has, it facilitates the absorption of iron, therefore strengthens the body's resistance to fight infection. So it's very important. And that's why the patients with vitamin C deficiency became anemic, is because they didn't have enough vitamin C to facilitate the absorption of iron. And so if you already struggle with anemia, you may want to look at your vitamin C levels as well. Lead toxicity, we think, oh, we're not at risk for lead. We stopped using lead in our paints, right? Most people think that because I have patients ask me all the time, well, lead, where am I getting lead? Well, you can get it from the soil in your yard. You can get it from pottery because they use lead in pottery. And when you heat that up, and you eat or drink out of it, you could be ingesting lead. You can get it from traditional remedies like makeups and powders and lotions that especially women are putting on multiple times a day. You can also get it in certain candies, jewelry, and some toys. So we still have toys being manufactured in other countries that contain lead, and our children are picking those up, putting them in their mouth, sometimes even chewing on them, and that's how they're getting lead toxicity. And lead toxicity will affect development and growth in your children, and it can cause a lower IQ, other learning disabilities, behavioral problems. I see a lot of kidney damage and blood pressure issues in adults. And so this can all be benefited, or you can excrete the lead out of the body by using vitamin C. Vitamin C, you would want to measure, if you know you have lead toxicity, you want to measure your blood levels, and then you take the vitamin C and then you measure it again, and you can see significant reduction of lead in the blood. Is an anti-cancer potential? Yep. According to the National Cancer Institute, some clinical trials have shown that cancer patients that are given high dosage of vitamin C, that's up to like 50 grams, they show improved quality of life and fewer side effects when using chemo and radiation. So there's a benefit in that regards. However, some other studies show that it's better to abstain from the treatment until the effects are fully studied. So I'll tell you from my personal experience that probably 90–95% of the clients that have a history or active cancer do well with taking vitamin C, but it really is dependent on the type of vitamin C that they take. A lot of the over-the-counter vitamin C's can actually stimulate an increase in blood sugar, which creates inflammation, which is counterproductive in battling cancer. So if you are a cancer patient and you're watching this and you're wondering, should I take vitamin C? Probably so, but make sure you check with your doctor and get the right type of vitamin C. And I'm going to talk about two of those that I use with my clients in my practice. Vitamin C, it aids in boosting the immune system. How does it do that? Well, it increases white blood cell production and circulation. So vitamin C helps increase circulation throughout the body and blood flow. And when you increase circulation and increase the stimulation of your white blood cells, it helps to boost your immune system. It can lower your blood pressure in short term. So if your blood pressure is up, you can take a dose of vitamin C and it can actually lower your blood pressure. The treatment with vitamin C has shown to be effectively cause proper dilation of the blood vessels. So it's not too much, it's proper dilation of the blood vessels in cases of arteriosclerosis, congestive heart failure, high cholesterol, angina pectoris, and high blood pressure. It also, I have looked at studies that helps to strengthen the integrity of the vessels. And Dr. Melissa Moser from the University of Connecticut, she discovered that it improves, she also discovered that it improves the blood vessel dilation and protects cardiovascular health. So she recommends it as well on a regular routine. It can help reverse cataracts. More and more people are struggling with cataracts, but it also can help with macular degeneration and other visual acuity loss. And so sometimes it may be that you're just deficient in vitamin C, and that's why you're developing cataracts. You want to look at other critical nutrients for the eyes as well. But we know that there's a direct link with vitamin C and cataracts. It helps you combat strokes. And you know, stroke is the 4th leading cause of death in the United States. And what's so sad is that 80% of strokes, stroke deaths can be preventable through lifestyle changes, diet, exercising, maintaining healthy weight, normalizing blood sugar and blood pressure levels. And if you're smoking, stop smoking. Very simple to reduce your risk of these types of strokes. What certain studies have shown, and I've seen similar studies, but this particular study showed that when taking vitamin C for patients who were deficient, significantly deficient, it helped to reduce the effects of stroke by 42%, which is pretty significant. So just taking a supplement can reduce your risk of stroke by 42%. Imagine what it would be if you did the supplement plus the lifestyle factors. So I highly encourage change in the lifestyle factors. Research also suggests, which we talked about earlier, how if you are vitamin C deficiency, you're going to be iron deficient as well, which will increase your risk of ischemic stroke. It helps with maintaining the elasticity of the skin and healing of the wound. So this has been very beneficial with diabetics and helping with wound healing, because a lot of times they will get ulcerations. But any kind of wound, actually, it can help to heal. It also increases collagen production. So you can't increase collagen production if you're vitamin C deficiency, even if you're taking collagen supplements. So remember that. I'm not saying don't take collagen supplements. They're great, but make sure you're taking a vitamin C, a proper vitamin C, while doing that to get the best results. When doing that, you can actually see the lines just melt off of your face and your skin become firmer and reduce all signs of aging, which we are all looking forward to. It can control the symptoms of asthma. So if you suffer from asthma, whether it's exercise-induced or it's actual asthma, vitamin C can help with that because it helps to protect the body from harmful effects of pollution. But what is so cool about it is that it helps to dilate the bronchial airways, which many times are being inhibited by histamine restriction. And so histamine foods like chocolate and certain other vegetables can actually cause inflammation in the bronchioles, and that will cause asthma symptoms. And so by taking vitamin C, you can open back up those bronchial airways. And so highly recommend it for anyone who is suffering from asthma or asthma-like symptoms. And so here's the types of vitamin C that I highly recommend. And my favorite, all-time favorite is is American Nutraceuticals Vitality C. And this vitamin C, the reason I love it, it's the closest thing I can get to an IV vitamin C, okay? And it's a lot less costly. And so the one reason it is so close to an IV vitamin C is because it addresses all 4 pathways. So I can get this vitamin C inside the cell is where it needs to be effective by using either the glucose pathway, the sodium pathway, the pentose phosphate pathway, or the bioavailable organic sulfur pathway. And so each one of those, it's very common. Most vitamin C's will try to use the glucose pathway, but what happens is that there's so many critical nutrients that are trying to get in through the glucose pathway into the cell that your vitamin C might be in a long line and may or may not get absorbed, right? And so you don't want to have to rely on just that one pathway, which is most of your ascorbic acid, vitamin C supplements on the market. Well, this has a sodium carrier, so it can take the vitamin C through the sodium pathway to get better absorption. It can take it through the pentose phosphate pathway, which is the GMS ribose, to get better absorption, or it can take it through the bioavailable organic sulfur pathway. So what is cool about that one is that anytime you're getting excess water and vitamin C inside the cell, is going to be pushing out the environmental toxins. So very amazing supplement for boosting the immune system overall. But the reason it is so powerful is because it has all of these, has the ability to go through all of these pathways and get intracellular. And just one scoop of this is like 4,000 milligrams of vitamin C, which most supplements over the counter is only 250. Now you couldn't take a high dose of vitamin C if it's over the counter, like you can with this one, because it would cause a lot of gastric upset. Then there's liposomal vitamin C, And you can buy it or you can make it yourself. And I'm going to share that recipe with you. But liposomal vitamin C, and I love Designs for Health. Quicksilver, I think, has one. There's some great companies out there that have good liposomal vitamin C. All that means it uses a fat to carry the vitamin C through the cell membrane into the cell. And so it's another pathway that you can use, but it's really only that one pathway. But it tends to be much more absorbable than the glucose, using the glucose pathway. So liposomal vitamin C or liposomal supplements are ideal when you're trying to get higher absorption. So how do you make your own liposomal? I highly recommend this if you have a large family, because this can get quite expensive buying bottles of vitamin C for your large family. You can make a 48-ounce batch, which will probably last you about 2 weeks if you have, about 5 to 6 members in your family. A 3/4 cup of lecithin. You can use sunflower lecithin, or if you can find it, the non-GMO soy lecithin. I recommend the sunflower lecithin. You need distilled water. You'll need the vitamin C powder. And then the directions you can find here. You will have to buy certain equipment like an ultrasonic jewelry cleaner. You can get those off of Amazon for like $100. A blender, I highly recommend the Vitamixer because it has the extra low stirring speed. And then the 1-quart canning jars with lids. Measuring cups, test strips, pH test strips, and plastic utensils. So it tells you step by step of how to produce that. When you make your own, you can store it in the refrigerator in your mason jars, and it will last up to 2 weeks. So great way to do it for pennies on the dollar. You can make your own liposomal vitamin C. If you've got the time, why not? If you don't, then choose either the American Nutraceutical Vitamin C or the liposomal vitamin C from Designs for Health, Quicksilver. And if you need more information on this, you can contact me at rightwayhealthandwellness.com. You can call the office at 404-474-2100. Or if you just want to order some of the supplements that we talked about here, you can email orders at rightwayhealthandwellness.com. I thank you for your time and your attention, and God bless you, and I pray that you have a happy, healthy rest of the week.